Ghana's President Nana Akufo-Addo has warned that the country's health system could soon be overloaded as COVID-19 cases soar. Akufo-Addo said he would impose another partial lockdown if cases keep rising at the current rate. Joining me now to talk about this is AFP correspondent in Ghana, Kent Mensah. Kent, good to have you with us on the Newsfeed Late Night.
Hi, good to join you.
What is the infection rate looking like currently in Ghana of new infections with this new strain of the virus now before many countries in the region?
Well, as we speak at the moment, currently we are recording, or we have recorded 1.9, close to 2,000, 1,900, close to 2,000 active cases in the country. A few days ago, we were a little below 1,000, so it means that our cases are going high. We have recorded confirmed cases of 58,000 plus, of which 56, 57 have recovered. So it tells you that on a daily basis, according to the Ghana Health Service, we are recording 200 cases on a daily basis since we entered into this new year.
And what does that mean as far as the health system in Ghana? Will it be able to hold?
Well, it puts a lot of pressure on the health facilities in the country because as we speak now, health frontline workers are complaining of fatigue. They said they have been fatigued for the past 1 year, working around the clock to make sure that we contain this virus. So it means that most of the initiative that they put in place to ensure that the country at least reduce the number of active cases seem to be not going as according to plan. So it means that we need to rally around the clock to make sure that we get a lot of our health workers, those on leave, and then also those who are supposed to go on leave and also retirement, to be readily on the ground to make sure that we contain this surge in the new coronavirus cases as we speak.
Now, Ghana not yet close to its peak, but let's look at the first wave. Where did Ghana peak in the first wave, and what is the expectation with the second wave?
Well, around November thereabout, there were fears in the country concerning the surge in cases. But surprisingly, because of the elections and then other activities that we had in this country, people thought that we were going to really peak during the election and also the Christmas festivity. But I think that we are now experiencing the ripple effect of what went on during the campaign and also the Christmas festivity as we speak. So as we talk now, officials have officially stated that we've entered into our second wave of this virus. But as to whether we have peaked or otherwise, it is up to the officials to confirm. But a lot of people are worried, especially when schools, basic schools reopen across the country today. And a lot of parents were really concerned and also worried taking their children to school because they felt that there is no way the teachers can take care of their children when they are in school. So most parents have decided to rather keep their children home for the next few days just to gauge how things will pan out in schools before they will probably send them to school from next week. But I went across some of the schools in Accra today, and I realized that most of the children are adhering to the COVID-19 protocols. You could see them wearing those masks, having their hand sanitizers hanging on their bags, and also schools do not allow parents to enter their premises except you have a child who is probably in preschool, then you can enter the school. But outside Accra, the situation is different. People are virtually not wearing those masks to school at all.
What is the approach taken by the Ghana government as far as reducing the number of infections? I tell you, currently in South Africa, we are under lockdown level 3, which has a curfew that restricts movement between 9 p.m. and 6 p.m. It also means there is no alcohol sales, for example, in the country right now in order to alleviate strain on the health system. But also we've just extended the reopening of schools. So what is the approach that is taken in Ghana?
Well, so first of all, we've closed our land borders to human traffic since March 2020. So they are still closed. Also, beaches are still closed. Nightclubs are still closed. But surprisingly, although officially they've been closed, people are still flouting the law and then operating clandestinely in the country. So the government is trying to empower tourism officials and then also the security to make sure that they go down to clamp down on some of these places which are still operating. The president over the weekend addressed the nation in his 22nd address, and you could really see from his face that he was visibly disturbed, saying that, look, if we don't take care and we still continue with the attitude of the behavior going on now, he will be forced to lock down the country, although he knows that it is inimical to the growth of the economy. So the Inspector General of Police has been empowered to make sure that he moved to town with his men to arrest or enforce the wearing of nose masks at public gatherings, at the market, in commercial vehicles, and also any other places that people find themselves gathering. So this is the enforcement that is going on. By the end of the day, we need to also find out whether people will really go strictly by this, because we've really slept for a very long time thinking that COVID was no longer with us. So people really no longer care what COVID is all about. But surprisingly, it is really springing up in offices where people are supposed to know better, and also top places. As we speak now, just this morning, the director of security, the top security person in this country, was officially confirmed of COVID-19. Also, other top officials are dying of it. So I think people are now coming back to their reality to say that, look, the disease is still with us, so we need to really be on guard.
Now, Kent, talk to me then about the country's access to vaccine. Has Ghana been able to be in the line to procure enough vaccine for the nation?
Yes, so on Friday, the presidential advisor on health promised the country that we are in the process of securing the COVID-19 vaccines into the country. I think that officially we have been promised 20 million vaccines, but he says that government is putting in measures to ensure that we procure excess or extra. So maybe by the close of the second quarter of this year, we are expecting to have our vaccine pending approval from the Food and Drugs Authority and also other related agencies in the country.
And as far as the skepticism around the use of vaccine, I mean, how rife is it? Are Ghanaians quite accepting of the vaccination?
Come again?
I'm saying the Ghanaians, are they accepting of the vaccination? There's a lot of skepticism around vaccines and their use, and how this could possibly affect those who take them.
Well, we've been reading a lot, or people are reading a lot of either, so to say, conspiracy theories and also stories all over online about the vaccine, saying that it doesn't work, and why is it that the cases are still rising in countries where people are taking the vaccine. So it depends on the individual and then what they think of, but on the whole, Ghanaians have generally not disapproved of the vaccine. I think that people are really expectant of what the vaccine will do for this country, and as to whether there will be access to everybody in this country, because when the presidential spokesperson on health spoke to the media on Friday, he says that they are still putting in modalities to see whether the health frontline health workers will be the first to be taken care of, or the aged, or student, or the elderly. So we are yet to see the plan that they have in place. But you know that, of course, we are in Africa, so people believe in a lot of natural remedies of curing some of these so-called diseases. So people are resorting to all sorts of herbal cure to see if it will work for them at home. So those are some of the dangers that the Ghana Health Service is really worried about, because people are not going to test because it is very expensive. So they decide to probably do their own medication at home, whether it is COVID or otherwise. They can't really tell. That's the issue on the ground now.
Now, of course, with those delays in the manufacturing of the vaccines, the owners are now on the country to contain the virus. Now, you've mentioned already that President Akufo-Addo threatens a lockdown. What would a lockdown mean for Ghana's economy?
Well, I must say that we can't afford another lockdown in this country, honestly, because we had a situation where locking down the country, not even the entire country, just the capital and some of its environs, and also part of the second largest city in Ghana, Kumasi, and people couldn't afford it just for a few days because we have a lot of the informal sector being deprived of their livelihood. These are people who sell on the street. These are people who sell in the marketplaces. So locking down the entire country would mean that we are virtually going to collapse our country. And I don't think that it is something that those in authority or those in charge would rather think of. Probably they may think of probably locking down a few satellite areas just to teach people a lesson. But locking down the entire administrative capital of this country will mean that we are shooting ourselves in the foot.
Kate Mensah, appreciate your time. Thank you very much for joining us tonight, AFP correspondent there in Ghana.